we moved from the days of because as a doctor I have said. These days a patient will be like, okay, so what are your qualifications? Hata ataenda hiyo university yenye ulisoma kuconfirm kama kenye mnasema ni ukweli. I have patients who ask me, hey, so what's your social media handle? I'm like, okay, what have they gone to do? Testimonials, reviews. What exactly are you talking about on your platforms, on your website? Like, people go back end to do due diligence. I usually tell patients and clients, our healing journeys are all very different. We could be having the same issue and you take 2 years and me within 3 months, I am done. I am okay. I am better. My quality of life is much better. I give you all the information in the world that I have. And then it becomes a you thing. Now you're the one to go home and change things, do this, do that, do that. You get? In our patient rights, our patient anaweza ingia kwa hospitali umwambie, this is the treatment plan, this is the protocol, because this is going to make you better. So they decide that, no, I'm not doing that. And the reason they've decided that they're not doing that is maybe it's financial. They don't feel like because maybe it's against their religion, or they don't feel like because they feel like wamepona, or whatever other reason, right? So you have a conversation. Remember, if you want to seek a second opinion, it's okay. You have autonomy. You can go and seek a second opinion. Be careful where you're going to seek that second opinion. The board usually requires us to put up our licenses. Whether you're a doctor, a nurse, CEO, pharmacist, pharmtech, you have a license. So a chemist, among manazita chemistry, must be registered for it to fully function. And mwenye ana operate hapo pia anafaa kuwa license. So si businessman, si economist, si engineer. Hapana, it has to be a licensed healthcare worker, and most preferably a pharmtech, because anaelewa venye hizo dawa zinaingiana na systems za watu, because they usually learn those things at school. As you said, there is a register for healthcare workers. Unaweza Google uangalie huyu ni psychologist, huyu ni daktari, ni obstetrician, huyu ni nini. Si ati ana claim kukua kitu fulani. These days hata we are being asked for our certificate. Like unapata we moved from the days of because as a doctor I have said. These days a patient will be like, okay, so what are your qualifications? And you tell them. Hata ataenda hiyo university yenye ulisoma kuconfirm kama kenye mnasema ni ukweli. So there's a lot of people are, let me call them woke, wamejua hizi vitu. So hata kama second opinion si to another specialist, utapata they are doing their due diligence in the background to actually check and see kama what you're saying is the truth. Umesomea hii. They'll enter your social media platforms. I have patients who ask me, hey, so what's your social media handle? I'm like, okay. What have they gone to do? Testimonials, reviews. What exactly are you talking about on your platforms, on your website? Like, people go back end to do due diligence. Matter second opinion as well. We have specialties. So for example, mimi si orthopedic. Like ukivunjika mguu na nione yenyewe ilivunjika na ikakaa hivi, hata ni decide na kupea personalized supplementation. So what I do is collaborate and work with other doctors in terms of maybe you need another assistance or something else. Of course, I will refer you to that person so they can be able to help you much better. Or I've worked with you and I've gotten to the point where, okay, now something is not working. Why is it not working? Maybe your mental space is not fully there 100%. Some external factor, external environment is bothering your health, which is interfering with our process. So what do we need? We need Samantha to go and seek the healthcare services of psychologist so and so. So after that, what we usually do, if I can access your psychologist with your permission and their permission, call and say, okay, hello, you've been seeing so and so, and I've been seeing this. Can we work together to ensure the benefit for this patient? Because you know what? When we work together, we find that our patients are actually improving way much better. And even though you won't be able to access this healthcare worker directly, you can get maybe a report they wrote or some tests they did. So you have some information and some dawas. Ndio maana mimi huambia patients kila wakati, have your information either on your phone, maybe piga picha, scan them, or put them in your email. So it makes it easier, even though you're going to seek another opinion, Because you could go seek another opinion and then you're told you need to do these tests before I see you. Na maybe labda tayari uko na hizo tests. You get? So unafanya double work. So seeking a second opinion, it's okay. I just tell patients, please do your due diligence to whoever you're going to seek your second opinion from. And remember, everything that we're doing is always evidence-based.